Hello. Today I'm here to talk to you about the different types of nipples. If you are on your third trimester or if you just had a baby and you are not familiar about what is the type of nipples, or if you're facing any struggles regarding the type of nipples you have, today I'm going to talk to you about those. So stay tuned. I have this fake breasts to show you a little bit how you can start exploring your breasts in order to empower yourself with the right feelings and the right sensations regarding to your breastfeeding area, okay? You might not know, but we have 3 different types of nipples. Yes, this is a regular nipple shape. When you have the nipples outside, you can see them, you can touch them, and this is very important for you to start touching and exploring this area even before you have your baby. Connecting yourself with your body is the first step for a successful breastfeeding journey. The other type of nipples is the plain ones, which means that you don't have this area outside and it's kind of turned a little bit inside of your nipples, so you don't see this external area, and this is plain. The third type of nipples will be the inverted nipples, when this full area is turned to inside, so you don't see them at all, and it's inverted towards you, right? So these are the different nipples. You can face some struggles breastfeeding your baby, especially if you have the plain nipples and the inverted nipples, which doesn't mean that you won't have any struggle with the regular nipples, because you can have some fissures around this area. So that's why it's so important for you to prepare your nipples to breastfeeding even prior to deliver your baby. Because once you have your baby in your arms, all the insecurity, all the lack of sleep, and the hormonal oscillations and fatigue can be very overwhelming, and together with managing a hungry baby. So if you are pregnant, I strongly recommend you to start exploring your body even prior. I am 36 weeks and I'm doing this every night. When I go shower, I start massaging my breasts to understand if there is any rigid point that I can solve by lightly massaging around the breast. This hand massage would be very helpful for you during your breastfeeding. This way, you'll be stimulating the ducts in order for all of them to work, stimulate the milk production, okay? Regarding to your nipples, it's also important for you to massage the nipples and start with massaging and making them like more elastic. So pulling this outside and then pulling this towards will help you, because of course your breasts are not used to have someone pulling this, right? When the baby will latch on your nipples, so start pulling your nipples out in order to stimulate the milk production. So make this impact lighter and more smooth. If you start doing that at home, even prior to the birth, will help you to have this area of your skin more elastic and prepared, so you avoid and prevent other damage in your nipples. There is one tool that I would like to present to you, that this is a Nipple Shaper. I use this one that is a little bit larger because I do have plain nipples, and I start doing this massage exercise, this practice prior to my baby's arrival, to pull your nipple out. Because even if you have plain nipples or inverted nipples, it doesn't mean that you don't have this part. So your job is to help your body to pull this out, and your baby will help you to do that once your baby's born. But if you start with this simple tool, even prior to deliver your baby, see how it works. It works by suction. You press this part and then you go like that, and this will pull. And we will fix it, right? There is a vacuum made with the air here. And this way, even if you have these nipples already, we'll make sure that you are practicing that elastic mode. But if you have plain or inverted, it will help you to pull every day a little bit more this nipple out. This way you have more elasticity in this area once your baby is latching, and will help you to prevent any damage and pain and sometimes even fissures with blood in your nipple area. So I recommend doing that starting at 35 weeks every single day for a couple of minutes in each breast. You leave it like that for like 2 or 3 minutes. If you can handle, you can leave it for 5, and then you turn and do it the same thing in the other nipple. This will help with this elasticity of your skin and also preparing with any trauma that can occur if you don't do that. I hope it can help you to have a very beautiful and successful journey of breastfeeding. Take care, mama.